Hi guys, welcome back to our channel Health Bar. I, myself Prerna Chhetri, will be dealing about a short topic that is known as a high-risk medication. So whenever we talk about high-risk medications, so these are a group of medication that has the potential to cause any kind of harm or even a death to a significant person whenever given in an error. सो अब हम लोग कभी भी बात करते हैं हाई रिस्क मेडिकेशन के लिए, तो ये सारे एक ग्रुप के मेडिकेशंस हैं जिसको हम लोग रिमेंबर कर सकते हैं, लाइक फॉर एग्जांपल सिक एंड स्माइल. So the first C stands for your cardiac stimulants. So cardiac stimulants are the group of drugs that are used for the cardiac patients. For example, atropine, adrenaline, you can say dobutamine, dopamine, etc. Now another C stands for your chemotherapeutic agents. So chemotherapeutic agents या फिर chemotherapeutic drugs are those group of drugs that are used for the oncological patients. So for example, carboplatin, you can say cisplatin, etc. Now A stands for your anticoagulants. So anticoagulants are your blood thinners जो कि हम लोग variety of patients के लिए use कर सकते हैं. The patients can be your in cases of your MI also or any other forms where you have to make sure that the patient is having any kind of clot, or you have to make sure if your patient is going under any kind of, you can say, ischemic shocks or so on. Right? So what happens is, in these anticoagulants are the group of drugs that make sure that the blood goes under your thinning. So examples like you can say heparin, or you can say even heparin or warfarin, etc. And N stands for your narcotics. So the widely used narcotics like morphine, you can say ketamine also, fentanyl also, and also your tramadol. S stands for your sedative. So sedatives are the groups of medication that acts on your brain cells. So कभी भी हम लोग sedative use करते हैं तो यहाँ पे patient को inactive किया जाता है, and also this causes sensory, you can say, a central nervous system is suppressed, with which your patient will be feeling a numbness. For example, you can say lorazepam, you can say midazolam are the widely used drugs in cases of sedation. And M stands for your muscle relaxant. So muscle relaxant are also similar to that of your sedation, but what happens is that there are various of uses. For example, the widely used muscle relaxant are, you can say vecuronium, you can say succinylcholine, you can say atracurum, etc. And after that comes your I. I is your insulin. So insulin is your hormone that has been secreted by your pancreas. So the widely used insulin that most of the healthcare or an organization use are human act rapid, human insulin, human R, and so on. L stands for your Lassa drug. That again, this Lassa has been further described as look-alike or sound-alike, जो कि हम लोग को दिखने में एक जैसे दिखते हैं या फिर सुनने में एक जैसे सुनते हैं. For instance, you will get to see dopamine and dobutamine. E stands for your concentrated electrolytes. So electrolytes can be various of form. The normal electrolytes like your normal saline, your ringalactate, cabilite, your dextrose, this all are different forms of electrolyte. But whenever we talk about a concentrated electrolyte, we are specifying on a certain, you can say, certain electrolyte, specific electrolyte, like you can say calcium gluconate, sodium bicarb, and so on. So whenever we talk about this high risk medication, we can use an abbreviation like SICK and SMILE. So these are the group of list of medications which are used as your high alert medications, or you can even say it to be as a high risk medication. Now talking about its storage. Not just the chemotherapeutic agents or chemotherapeutic drugs are stored in an oncological department, whereas the rest of the medications are stored in your single lock and key. Now talking about the narcotics also, this narcotics has a separate, you can say, storage system in which a single lock and key is not suggested, but instead of that we make use of a double lock and key. In this double lock and key, both the keys are being kept by the different health professions. And whenever a narcotics is being issued, you have to make certain, there has to be a certain list of protocols that a healthcare professionals has to follow and do the needful for the patient. Now we also talk about the insulin, in which what happens is, once the insulin is, again this insulin also depends upon your different organization or the practice that a hospital takes. Now insulin, when in most of the hospital in NABH, if the hospital is aggregated with the NABH1, then this is stored in the refrigerator, and once opened also it is again stored in the refrigerator. But if you are working in a certain organization that is been accredited with NABH as well as in GCI, in many of the organization it is a practice that once the insulin is in intact form, it is kept under the refrigerator. बट वंस इट इज़ बिन ओपन, आपने एक बार खोल दिया है इस इंसुलिन को, तो हम लोग एक बार खुल जाता है तो हम लोग ये कई हॉस्पिटल में या फिर कई ऑर्गेनाइजेशन में ये बेड साइड ऑफ द पेशेंट भी रखते हैं. Now talking about this, we have already dealt about the storage. Now we talk about the discard. So whenever we talk about any kind of example, I would like to give a short example. For instance, if आपका पेशेंट को कार्डियक अरेस्ट आ गया है और आपने यूज़ किया है एट्रोपिन, एड्रेनालिन, साथ साथ में पेशेंट को इंटूबेट करवाना था, तो आपने मिडाजोलम भी यूज़ किया. Now as we can see, midazolam every time it comes in, you can say it does not come in an ampule. So ये vials में आते हैं. तो इफ़ आपने कोई भी वाइल्स को तोड़ा है, आपने वाइल्स को खोला है, वंस यू लोड द मेडिकेशन एंड द वाइल इज एम्प्टी, यू हैव टू मेक श्योर द अपर पार्ट इज नॉट हैविंग एनी काइंड ऑफ शार्प एजेस. सो दिस this vial has to be discarded it in your, you can say, dark blue bin, right? But if you have opened up an ampule, that is, for instance, in our case we are using atropine, adrenaline, so that comes in an ampule. So what we have done is we have broken the ampule. So once we break the ampules, what we get to see is that there will be a sharp edges in it, so it can cause any kind of an injury to the person. So as this is a sharp object, so we are after making use of the medication, we have to discard this ampule in your sharp container. Now if there is certain kind of leftover, for example ADR भी यूज़ किया था आपने और ADR का आता है 1 ml में, but आपने 0.5 ml यूज़ किया था और 0.5 ml was remaining. So what do you do with that 0.5 ml? So now what happens is that 0.5 ml को आपको सीधा डिस्कार्ड करना है आपकी येलो कलर की बीन में, and the ampule or the vial that you are using, mostly it is your ampule, so if that is a sharp, then you have to discard it in the sharp bin. Now talking about, you can say, narcotics, right? So narcotics come in different various forms. It can be in forms of tablet, it can be in forms of injectables, and even it can be in forms of your patches, है ना. So आप लोग कभी भी patches use करते हो, तो after the use what you are supposed to do is cut into smaller pieces and you have to rinse under running water under the supervision of any of your higher authority. It can be your doctors, it can be your nursing in charge, or it can be even under the supervision of your nursing supervisor. But instance, if you are making use of any kind of injectables and half of the amount of medication is remaining, so what do you do with that amount? So half is been given to the patient, whereas the half is remaining. So what will you do is, again this also has to be discarded under running water under the supervision of your any of the higher authority. Now if you are making use of in forms of tablets, if some amount of tablets has been administered to the patient and half of the tablet is been remaining, then you have to crush that tablet into smaller pieces, and again it has to be discarded under the running water, again with the help of your higher authorities. Now talking about the wrappers, or you can say the cover of any of the forms of the medication. So this cover of the medication, if you are making use of an injectables, so उसके cover भी आएंगे, if आप patches भी use कर रहे हो उसके covers भी आएंगे, या फिर आप कोई भी tablet भी use करते हो narcotics के, उसके भी cover आएंगे. तो हम लोग को ये करना होता है कि ये covers को हम लोग को वापस से जहाँ से आपने narcotics को issue करा था वहीं पे जाके आपको वापस देना है. We cannot restore, neither can we discard this cover of any kind of narcotics. So I hope you all gained a knowledge about what are high risk medication, how we can, you can say, summarize what are the list of high risk medication, how to store it, how to discard, and what are the different forms of this medications, examples as well. I hope you like this topic. Please hit the bell icon and please do give us a comment as a feedback, and please bye bye.